pregnancy should be a time of joy and not anxiety for the woman and her family. Do you want to learn more about pregnancy or have questions about fertility and reproductive health? Then join Dr. Linda Vanutu on Facebook and YouTube every Saturday at 4 p.m. on the online pregnancy school as she discusses pregnancy, delivery, and childcare with experts.
Hello, dear viewers. This is your favorite program, the online pregnancy school. It is always a pleasure to come your way. There are so many things that one has to know about pregnancy, childcare, and delivery, and in fact about reproductive health. And that is why we have brought you so many topics, very, very interesting and educative discussions. Please don't forget to visit my Facebook page on Dr. Linda Vanutu and listen to our previous discussions. Also, go to my YouTube channel, subscribe to the YouTube channel so that you'll be informed about everything that we'll be discussing. Today, our program is once again sponsored by Promise Ghana, Vanutu International, Reverse Tap, Samsara Ventures, and Erama Clinic. Let's go for a short break. Welcome back. Our topic for today is alcohol use in pregnancy. It's a topic that I'm sure everyone should be concerned about because some people may be wondering, should a pregnant woman take in alcohol? If she can, how much? If she cannot, why not? And that is why we are happy to discuss alcohol use in pregnancy today. My guest for today is Dr. Yao Edusi Poku. He's the program manager for the National TB Control Program, Ghana. But today he's not going to talk about tuberculosis, but we are going to talk about alcohol use in pregnancy because he and some other colleagues did some work on alcohol use, and we believe that it will be a very important topic for everyone to know about, and that's why we are talking about this. Doc, you are most welcome.
Thank you so much.
Thank you for your time. Thank you for joining us to discuss this very important topic on alcohol use in pregnancy. Please, what is alcohol?
Good question. So, alcohol is a mixture of water and another substance. It comes in varying concentrations and it comes in various brands. So you have Akpeteshi, you have Kasapreko, you have Pusha, and then you have the beers and the Guinness. So they come in so many forms. And if you talk about its mechanical characteristics, or what you call the physical characteristics, it is very, very sharp to taste, depending on the concentration. And even though it has some beneficial effects in some aspect, it also has very detrimental effect on another aspect. So whilst it is good for cleaning as an antiseptic, it can also be very detrimental when you take in alcohol to some extent. So alcohol is a kind of substance that affects every part of the body. We call it the system. It affects every aspect of the system of the body. Once alcohol is taken in, a lot of that, about 20% of the alcohol is worked on in the stomach. Then the rest descend to the small intestines, and then these are absorbed into the bloodstream. Then this alcohol goes everywhere, to the brain, to the heart, to the liver. And the liver is the main source of the breakdown of the alcohol. And then in some, then afterwards, urine, sweat. So it is we call it a multi-systemic effect. It affects every part of the system, but mostly the heart. The heart is affected, and then the liver, to the extent that with a prolonged intake of alcohol, the liver has various conditions, but getting to the latter stages, it becomes like strands of cords called fibrosis. And if the person is not lucky, the person ends into cancer of the liver. So it can even go as far as the pancreas. There's an organ at the back of the stomach where it is affected. It is the one that has a form of function to control sugar in the blood. Then this pancreas is also affected, becomes inflamed. So in general, alcohol can have a detrimental effect. We all know when it goes to the brain and you are driving, you know what can happen. It depresses the cognitive function or the thinking ability or the reasoning ability of the individual, and therefore an individual makes terrible judgments that can cause accident, and it has a lot of effect, bad effect. Insana nkasa insazin wofren insazin dem na mfansefo wokan insan no din onomo a efa oyem na awura wonsunum na akọ mogya mu edu mogya mu a etene kọ baabi bebre eba wadwenem eba wakoma wakomam yenka ne se wakomam na wakomam eba ba obrɛboom na ya baabi a etumi ha adwene pa ɛyɛ wakomam ufiri hɔ a na aba obrɛboom na sɛ yan nim sɛ brɛboɔ no kra etumi ya onom afi de obehu sɛ n'ani kosue ayɛ yellow ayɛ te sɛ akokɔsrade no nya no nko an etumi ma no basa but in sardine so ka ho because sardine din a ebi te sɛ apetahyi ebi te sɛ whiskey de insan mu odin pa no kasaprako ne pusha ne ade nyinaa ka ho na eba saa no a na nipa kono tumi nya cancer ne brɛboɔ no ɛkyaakya so a nipa kono kwa na koma no tumi nya heart attack firi na sɛ yan nim sɛ eba adwene mu di a sɛ yan nim no etumi eba na afedie nipa kono no ontumi nwene papa The can't believe because in the judgment, no, any papa, car crown no the court watching. So, inti who you be kind who are you? Who are you? Who are you? Who are you? So, inti a cobe beer to me say or your bema to me can a bema no. So, inti in Sunday, so benya enka utumi twon ho free ho ankaye. That's it.
Isn't it interesting? We are learning a lot. Please don't forget to invite friends and family. Let's go for a short break. Welcome back. We are talking about alcohol use in pregnancy. My name is Dr. Linda Van Utu, and my guest for today is Dr. Yao Edusi Poku. We are talking about alcohol use, and specifically in pregnancy. Doc, thank you very much. So we now know what happens when somebody takes in alcohol, generally. But now let's talk about the pregnant woman. What happens when a pregnant woman takes in alcohol?
You have asked a very good question, Doc. It was difficult before we did a certain study to determine what percentage of alcohol we're drinking. So we took a district. We did a study in a district. And after interviewing these pregnant women, we came to the conclusion that if you took 100 persons, 20 of them were drinking alcohol during pregnancy. And it's very, very sizable. I mean, if you look at other countries where pregnant women were drinking, so we got about 20% of them that were drinking. As we go into it, you realize that the sad thing is that some even thought that alcohol had beneficial effect to the baby. It washes the baby. And that was the sad thing about that. So when it comes to in other, like the males and the females who are not pregnant, when it comes to alcohol, we say that if a man takes about 2 bottles a day, it's all right. 2 bottles or let's say beer a day, it's all right. If a lady takes about a bottle a day, it's all right. But for pregnant women, alcohol drinking, whether a bottle a day, a tot, it has profound effect. You don't need to drink 1 bottle or 2 bottles to have effect on the baby. So that is the special aspect of drinking in pregnancy. So in this study that we did, a lot of them were taking Akpeteshi. And they were taking, majority were taking half tot. The rest were taking the whiskey, the ginseng, the pusher. They were taking full tot. Half tot is about 15 mils, and full tot is about 30 mils. So that is what they were taking. Most of them were taking Akpeteshi. About a third of them were taking Akpeteshi, and then followed by the ginseng and all that, the pusher and the various. And it doesn't need, let me emphasize this. You don't need to take even a little to have effect on the unborn baby. A small one can even have effect. Thank you.
Doc, this is very interesting. So please, what are the effects on the pregnant woman and on the baby as well?
Thank you very much. So on the mother, it's the same as the general population, the effect of alcohol, as we have mentioned. We have mentioned that it can affect the brain. And so when it does, with large quantities on the mother tends not to eat well because her judgment is now clouded. So nutrition-wise, mother forget that she's even pregnant, so she must eat so that the baby can also be healthy. And when it happens, it affects the heart, as I said, it affects every part of the body. More importantly, because in pregnancy, the metabolism of the alcohol in the blood is not the normal one now. So alcohol tends to keep prolong in the blood, and that affects the baby. The first part of the effect is the brain of the baby. So the brain is affected. It also comes with some physical defects. You can describe it in the eyes, on the lips, on the ears. You can see that something is amiss. It is we call it in English as a spectrum from A to Z. What it means is that it may have a mild effect on the child to the extent that you may not even recognize it. So that is on the lower end of the spectrum. On the higher end of the spectrum, it's so severe that the child may lose the ability to study, to learn. That's the word, ability to learn. So learning is affected. So in short, it affects the cognitive function and then the physical appearance of the baby. Neurologically, the child is affected. So the child may not be able to walk on time, and so on and so forth. We call it a constellation of factors, or a syndrome, sort of. So this is it. I forgot to mention the reason why we did this in Twi, the study. So if, with your permission, Dr. Vanuatu, I want to switch to Twi, if you wouldn't mind. Yeah. Inchi adekonti ayeye sa adesua hunu ayeye the study, the research na ayeye ne se ofa yeye research no obosontwe na eno achi no na ya tete se ho no so ema no asram oya os me banya asram na dia ni asram kra asram ni yehunu se de monim no asram no ete se akola ya wo na sebi ogya na adwene ho kakra ono a so on nantie no unhu akola no ontumi nante akola no ontumi nkasa yie wohwe n'anim a unhu sɛ n'anim no asesa kakra nti eba saa no a na omo free sɛ bebree free sɛ asram no de ɛyɛ adutuo ana ye de ye nti bohu sɛ obi a otete baabi o se menyim timi ma obi papa we di ana ma me we de me ma ne hu menyinsa ne da sɛ ohunu a ɔde asram bɛyɛ no na sɛ de no enoma si kɔ ne yɛpɛsi ehu sɛ omu nim sɛ asram na ɔmo ka no ensaden kora tumi ma na ana na werɛho ɛwom ni sɛ about 10% imu chichemu du eka sɛ ensa kora de ɔno kora na wohoro akwala no nti normal ma ye study no ebi na mabobɔ so no yeah so it becomes evident more when the child starts schooling. The child has something we call attention deficit. When we are all supposed to be quiet and be listening to the teacher, the child is not quiet. The child is not paying attention. The child is doing something different. The child doesn't understand the topic that we are treating. And the smart teacher then brings the mother or the parent to the school. And the smart teacher gets to know that the mother has been drinking. The mother has been drinking. So it manifests like that. Like I'm saying, it's a spectrum. And therefore, for some too, the child it's not noticeable, except that when we are doing very, very deep calculation, then the child is found wanting. So for some, it never manifests. And for some too, the severe ones, as I've mentioned, the attention deficits and all that, difficult to learn. So as the child is growing, this is what happens. And you can notice this, or you can diagnose this when you take a very good history of the family, social history, we call it in the medical field. And then you get to know that the mother has been drinking. In one study that we did, it is the man who goes and shop bountifully and bring the alcohol to the home and make sure that the mother drinks during when it's time to eat. So the man was encouraging the woman to drink. That is it's possible where the alcohol has so much depressed the baby's neurological functions. And so the baby is born. Your baby say watrope in tree. So the baby is born. You can see that unlike the normal one that is crying excessively, kicking, you see the baby is quiet. There are other reasons for that. So it will be left with the neonatologist, the pediatrician neonatologist, to make a very good decision on this. So I will not push myself into that area, but that area is not so much my field. But what I know is that, yes, it has so much depressing effect on the baby.
Thank you very much. Ladies and gentlemen, I hope you have called others to come and listen to what we are talking about today. It is a very interesting topic. My name is Dr. Linda Van Hutu, and my guest for today is Dr. Yaw Edusi Poku. We are talking about alcohol use, and specifically in pregnancy. So please, as we come to the end of our discussion for today, what are some of the complications that we should expect in women who take in alcohol?
Yes. So the woman, of course, the first thing is that the woman may lose the pregnancy. The woman may lose the pregnancy as a result of accidents. the woman drinks, judgment is clouded. The woman trips. Sometimes they fight. They fight because alcohol has changed the mood. And therefore, it's a substance abuse. Alcohol is one of the substance abuse. So their mood change and they fight. So physically, and they lose the pregnancy. Aside that, they can have hypertension out of the drink. So it has so many effects on the mother. So, and it affects the organs, as we have mentioned again. So basically, the mother may lose the baby if she carries the pregnancy to term. Organs of the mother are affected. Complications. So these are some of the things that may happen to the mother. The mother physically, judgment is clouded because she has been drinking, and then she finds herself losing her baby as a result of accident occurring, as tripping in the bathroom, for instance, hitting a vital part of the body against anything, and then losing the pregnancy. And then the medical aspect, where it is affecting part of the organs, and therefore this one, it affects the woman. Then we have also talked about the baby. Yeah, research near and the who say, Oma no mo boa ema omo nom nsa nurses no a omo wo we no anase so omo wo antenatal clinic no. Oho de bebre ka se ema no omnyem no bebre ka se so mu duru ho a aya omo ka nsa ho asem. Nti nsa na omo ka no aya eto masum. Nti bebre efa etu omo ho fo wo ho. The toso the who ye say, Oma no mono no, bebre na omo ye JSS for. Inti nature say a hoso so a war aban say, aban bema bebre ako mani mo school. Esan say ye who say, Omo no mo ko mani pan kakra bi na nanom sa. Nature say wo kona na wo hu say, insan nya de papa. Inti eno so e wo homa aban. The toso ni say, one more I was say a border rule a radio movie bebre. The son say, bebre no, omo mufisa or no omonum sa a cockfro aqualano hono. No munko school, sabi no munko school. Indeed, nature say, sabi so I can come by anything. On cool school I can come by anything. Indeed, the can radio so and no better. Indeed, a bab one pa say, the bay radio discussions. Pa and ye who say one more mudigano. And then no pa, one no mudigano. And yet, I should in normal dream now, Bob bear 12 o'clock na accommodino. No was ma say, Yanko top in Sunny Bimran San were didi. Intiabe ye pa say, Sir, a grim radio announcement na ya ye in dream no. Ye twa so pa near ye na one tibi. Inti na masem kakra me wono no.
Well, ladies and gentlemen, we have heard a lot. Doc, thank you very much. You have given us a lot of insights into why pregnant women should not take even the slightest amount of alcohol. You know, alcohol has effects on the adult, whether a man or a woman. So if an adult whose liver is already developed is not able to handle it, how much more a child, a baby inside the mother's womb? Because the alcohol will go to this baby. You don't want to do that. So please, don't drink alcohol if you are pregnant. If you cannot eat, if you have any reason why you are not able to eat, or if you are vomiting, please go to the hospital. The nurses will see you, and if there's anything that they can do to help you, they will do that, please. And also for those who think that when you take in the alcohol, it washes the baby, there is no way that the alcohol can go and wash this baby when the baby is inside the mother's womb. Let's go for a short commercial break. So you see, there's no reason why a pregnant woman should take alcohol. Please. Enuanom Mr. Juan. Se nyinsan na se erefia, ebidum nyinsan na wofe. Se ntumi ndidi a, ebidum nyinsan na wontum wondidi. Na ne nyina no ojai, odu baby a ojai. Na se wo ho, na se wo yiri nyinsan anada wankase po ye besia na nyinsan na erefe ana ntumi ndidi ampo chow. Na ma nsa onye bibi ediri ya no Mr. Ko hospital na wonhwe se drubi na wode ba mo sabet na wode ba yew wa ya mo osande na nsa na no ye dindam na sebio apemfu bi mu wonom no wonka se ye panyini po enoma otumo oka wuti wombrebo wa hrawa bibia na afrakitikita ode ye funum minjinze ye pede ye dam timpo chow memma apemfu wonfa nsa wonfa nka hwana no ejize obeye no dam. This has been the online pregnancy school. My name is Dr. Linda Vanutu, and today my guest was Dr. Yao Edusi Poku. He's the program manager for the National TB Control Program for Ghana. But today he spoke about alcohol use in pregnancy. I hope you have learned a lot. Please don't forget to visit my Facebook page at Dr. Linda Vanutu to listen to the previous discussions that we have had. And also, go to YouTube and like my page. My page, you will find it as Sound Health and Investment Consultancy, SHIC Ghana TV. So subscribe to our channel and you will have all the upcoming events. Please share with friends and family. Thank you for your time. This program has been sponsored by Promise Ghana, Vanutu International, Reverse Step, Samdara Ventures, and Erama Clinic. Thank you all for your time. See you another time. Bye.
Pregnancy should be a time of joy and not anxiety for the woman and her family. Do you want to learn more about pregnancy or have questions about fertility and reproductive health? Then join Dr. Linda Vanuatu on Facebook and YouTube every Saturday at 4 p.m. on the online pregnancy school as she discusses pregnancy, delivery, and childcare with experts.